welcome to the afternoon session of the Health Pharma Life Sciences Biotech. My name is Ronan Byrne, and I'm CEO of a company called Clearsight Innovations, who just was asked to moderate the session here this afternoon. Clearsight Innovations' background was a company that developed novel technology in ophthalmics. We started, built and sold a company. We started 3 years ago, sold the company 2 months ago to a big multinational. So we know a fair bit about the medtech space and innovation in that space. So I'm moderating lots of few questions in there. But it's an interactive session. I think the idea is for people to get involved, ask questions. Each session is only 50 minutes long. So at the end of each session, we'll probably have a Q&A very quickly and move on to the next. So first up is Jess Walsh from UCD. Jess, over to you.
Great, hi everybody. Thanks for inviting me here to speak this afternoon. I'm going to talk to you a little bit about monitoring patients undergoing chemotherapy using mobile phone technology, which is a trial that we're running out of UCD as part of an international European trial funded by the FP7 program across 14 clinical sites across Europe. So I'm just going to start with a little bit of background. Outline of the presentation today, there's a small outline of the e-health strategy within Ireland, a bit about remote technology in cancer care, which is the way that things are going across healthcare, an overview of our project, which is called eSmart, and the challenges and achievements that we've encountered to date. So, e-health in general terms is described as the transfer of resources and health information by electronic means, be that using mobile phones, computers, the internet, etc. And it's certainly the way that healthcare is moving towards. Within this country, it's a useful diagram actually showing that the patient obviously is the centre of healthcare. Everything that we do is patient-centred, but the integration of e-health using technologies can help get the information from the patient to the clinicians and back in a timely and accurate manner without too much delay to the patient, obviously keeping the patient as the focus. Again, within this country, there were 7 strategies presented to the HSE to move forward with e-health and integrating that into an already complex healthcare situation that we have here. The one that I'm going to focus on today, is highlighted there, is obviously the Cancer Care e-health program. A little bit of this morning's session touched on a lot of the figures I'm about to go through, so I won't go through too much. Focusing on recent-ish Irish data, that 20,000 people were diagnosed in 2012 with a type of cancer excluding non-melanoma cancers. And of those, there were 8,781 deaths, and the number of people living with or beyond a cancer diagnosis was over 130,000. Obviously, that sort of demonstrates that it's a significant problem in this country, and a significant thing that people have to deal with. So, treatments for cancer, a lot of the patients that we're seeing are having chemotherapy as part of their treatment. It's a very common treatment, but it does come with significant side effects. A few of them are listed there. A lot of you will be familiar with the routine ones of hair loss, nausea, vomiting. Alongside these side effects, they can become more and more serious and lead to life-threatening infections, which then impact on the patient's quality of life. They need a lot more treatment to get them back into a well place. So we need an effective symptom management strategy, which is where the eSmart trial comes into play. The hypothesis of the system is that we will reduce the symptom burden for the people on the trial suffering from breast, colorectal and hematological cancers, which are the patient group that we are focused on for this particular trial. And hopefully improve their quality of life and their symptom burden during the chemotherapy and for their follow-up after the treatment. So, this is a demonstration of the model of the device that we're using. So you can see on the left of the diagram there is obviously the patient, who, as I mentioned already, is the centre of all of what we do. you can see next to the patient there is a handheld device which the patient has in their own home. They enter any symptoms that they are experiencing on a questionnaire basis once a day, as well as taking their own temperature and recording that into the device. Any symptoms that the patient report then get sent into a secure data management system, which then interprets those answers according to preset algorithms, and then the results are then farmed out in a traffic light system. So if the patient is well and not experiencing any symptoms, they wouldn't create an alert as such, they would be a green alert, so no real action needs to be taken for that patient. If the patients are having moderate symptoms that might lead then to early symptoms of needing a hospital admission or needing extra intervention, their clinical team in their own chemotherapy unit get alerted, and the nurses on the chemotherapy unit will phone the patient at home within 4 hours of that trigger being alerted. So they can obviously assess the patient over the phone, whether they need to be admitted to hospital sooner or later, or give them self-care advice to use within the home. If the patient's symptoms are more serious, it creates what we call a red alert. So the patient will then get a phone call from their clinical team within half an hour to obviously give them sort of acute advice on what to do with their symptoms to sort of stop them getting any sicker, if you like. So the devices themselves, the one on the left there is what the patient has at home. It's using a technology called Advanced Symptom Management System, which is a preset questionnaire based on an overall overview of any symptoms that chemotherapy patients can experience. They get these questionnaires, they answer these questionnaires daily, as I've already mentioned. As well as that, in the device there is a lot of self-care advice, information to the patients to use at home should they have any questions and they don't want to have to call into the unit, which can prove difficult at times. On the right hand side there is the device that the clinicians get when an alert comes into the hospital. It's almost like a paging system, which alerts the clinician holding the phone that the patient needs to be called, gives them a background of their symptoms, their treatment, and where they are to date. Feedback from the patients, we're in the feasibility stage at the moment, just making sure the technology actually works in the sites across Ireland. So far so good. In all 4 of our clinical sites, which is Vincent's Public, Vincent's Private, James's, and down in Waterford, it's integrated really well, and there's been no technological problems so far, touching wood. And we're looking forward to moving on to the RCT phase in the near future. So really excited to be rolling it out to a larger group of patients. Challenges that we've encountered, obviously it's a large trial, 14 EU clinical sites. There's a language barrier, there's a lot of different interpretations of chemotherapy, the symptoms the patients experience. Integrating a new healthcare model into an already existing, some might say a little bit backwards healthcare system, but there's not much we can do about it, is a little bit of a problem. Data protection was ethically is a big area, as you can imagine, but we've managed to obviously gone through all of the individual ethics committees in every site in every country, which again is a challenge. And clinician, obviously, and patient concerns, is it going to work? What's going to be the benefit for me as a patient or as a clinician? But we managed to overcome those challenges so far. So, as I mentioned, we've integrated it into all 14 clinical sites, translated it into several different languages. Some poor person had that job. And successful feasibility, all sites have made sure that this will work technologically. So we're all moving forwards to the RCT. In conclusion, it's a pioneering research project that can really change the way that we treat patients and the way that patients report their symptoms, and hopefully stop them getting too sick too late without having to sort of go down the route of invasive, really horrible sort of treatments and stuff for the patients, and hopefully increase patient satisfaction and reduce overall healthcare costs. And there's a quote there from one of our participants. Similar feedback to a lot of them, actually, they like the security of having that in their pocket, that they can alert people if they're having symptoms at any time during the day or night, and there's somebody on the end of the phone who will call them on the basis of those symptoms. So, just a few acknowledgements there, just to show where our clinical sites and clinical partners are across Europe and in the US. That's it from me. If anybody has any questions?
Fantastic initiative, first off. Is the technology that you're using classified as a medical device? And if yes, how are you validating the algorithms? Because you're having an impact on patient outcome, it is a medical device, the software that's been used. So I'm just wondering how you're doing that or how you're doing that.
So all of the algorithms, the ways that the questions are interpreted, the questions themselves were all done in the pre-feasibility phase. So all of our technical partners, the clinical partners across sites, all of these have been evaluated already before we put them into use with patients. So on proven, the ability to see if they've been proven, the fact that the alerts will be created on specific symptom sets has already been validated through previous work that was done before the trial began. So we know that it works for this group. Just asking my colleague, yeah, the ASINs, yeah. The technical business goes without ASINs.
Thank you, Jess. Yeah, actually, I had the same question for you. Just the validation of the algorithms is something that's obviously critical to something like this.